All right, let's jump into another deep dive.
Hmm.
Today we're talking about something that might not sound super exciting at first, but it's actually a lot more interesting than you might think.
I agree.
Hospital nutrition.
Yeah, we're not just talking about, the food that they serve you when you're in the hospital.
Right, exactly.
It's more about how healthcare professionals figure out what your nutritional needs are when you're in a situation where you need extra care.
Yeah, so if you're recovering from surgery or you have a chronic illness,
Absolutely.
we're going to be looking at all of that.
Like, how do they know that you're getting enough of the right things to heal?
Right, and what happens when, things aren't going so well and you're not getting enough of what you need?
Yeah, what are the interventions that they can do?
Exactly. So we're going to be looking at all of that today. And, even if you're not a doctor or a dietitian, I think this is really important information for everyone.
Oh, absolutely.
Because we're all going to be in a hospital at some point in our lives, hopefully not too often.
Right.
But it's good to kind of have this basic understanding so you can advocate for yourself or your loved ones.
And a lot of these insights can apply to your everyday life,
Yeah.
just in terms of making healthier choices overall.
Absolutely. And, you might be surprised at what you learned today.
For sure.
So let's get started. First up, let's talk about a term that we hear a lot, which is malnutrition.
Malnutrition.
So what does that actually mean in a hospital setting?
Right. So it's not just about not getting enough food, although that's certainly a part of it.
Okay.
It's more about your body not having the nutrients it needs to function properly and to heal.
Okay.
So imagine, your body is like a car that's running low on fuel.
Okay.
And it also has engine trouble, right?
Got it.
That's kind of what malnutrition does to a patient.
Wow, that's a really good analogy.
Yeah, their body can't really get going, to heal and recover.
Yeah.
So specifically, we're talking about protein-calorie malnutrition, which means they're not getting enough protein and calories, which are essential for building and repairing tissues and for energy.
So it's like a double whammy, affecting
Yeah.
both energy levels and the ability to heal.
Exactly.
Wow.
And the thing is, it's actually really common.
Really?
Yeah, studies estimate that up to 50% of hospitalized adults in the U.S. are malnourished.
It's a really high number.
Yeah, it's pretty shocking, right?
Yeah, I had no idea.
So to kind of illustrate this, let's imagine a hypothetical patient. Let's say his name is Miguel Hernandez,
Okay.
and he's a 46-year-old man who's admitted for a laminectomy,
Okay.
which is a back surgery.
Okay.
Now, before the surgery, Miguel was in a lot of pain, so he wasn't eating very well.
Makes sense.
And on top of that, he also has type 2 diabetes.
Okay, so he's already got some health challenges going on.
Exactly. So he's definitely at risk for malnutrition.
Right.
So how do doctors and nurses even figure out if someone like Miguel is at risk?
Yeah, that's a good question.
There are actually 6 characteristics that they look at, but for Miguel's case, the 2 most relevant ones are unintentional weight loss and poor appetite.
Okay.
So if they see that he's lost weight without meaning to, or he's just not interested in eating,
Yeah.
those are red flags that something might be up.
Gotcha. So they're kind of looking for these warning signs.
Exactly.
Right.
And if they see those signs, they're going to call in a nutrition expert,
Okay.
which is usually a registered dietitian.
So the dietitian is like the nutrition detective
Exactly.
coming in to figure out what's going on.
Right. They'll do a more thorough assessment. They'll look at Miguel's medical history, his usual eating habits. They might even check for things like difficulty swallowing,
Oh,
which could be affecting his intake.
that makes sense.
And then they'll use all of that information to develop a personalized nutrition care plan for him.
So it's not just a one-size-fits-all approach.
Nope, not at all. It's very tailored to the individual patient.
So the dietitian's kind of like tailoring a suit, but for nutrition. I like that analogy.
Yeah, they're making sure that the plan fits Miguel's unique needs.
That's great. So the dietitian figures out the problem, comes up with a plan, but then what?
Right. Then the question is, what does actual nutrition therapy look like in a hospital setting?
Yeah, what does that actually involve?
So the first step is to figure out how many calories and how much protein Miguel needs each day,
Okay,
right? Because everyone's different.
right.
And they'll take into account his age, his weight, his activity level, his medical condition, all of that.
So it's like calculating the right fuel mix for a car.
Exactly.
Got it.
And then it's not just about making sure he eats 3 square meals a day.
Right.
Sometimes patients need a little extra help.
Okay.
And that's where things like high protein shakes and supplements come in.
Okay.
So those are kind of like pit stops for extra fuel and repairs.
I see. So it's not just about force feeding people bland hospital food anymore.
No, definitely not.
There are more options now.
Right. It's about making sure they're getting the nutrients they need in a way that's palatable and convenient.
Yeah, that makes a lot more sense.
And you know what? It turns out that giving patients more control over what they eat actually helps them eat more and feel better.
Really?
Yeah. So instead of just bringing them a tray of food that they didn't choose,
Yeah.
some hospitals are moving towards a room service model.
So they can order what they want.
Exactly, like you would in a hotel.
Wow, that's a big improvement.
Yeah, and dietitians can also suggest things like high-protein smoothies
Okay.
or fortified snacks to help patients reach their nutrition goals.
Wow, this is a lot more interesting than I thought it would be.
I know, right? There's a lot more to it than meets the eye.
Definitely. But let's not forget about the nurses.
Right.
They're the ones who are with the patients all day, every day.
Absolutely.
So what's their role in all of this?
Well, nurses are kind of like the nutrition quarterbacks. They're making sure that the game plan is being executed and that everyone's on the same page.
So they're like the liaisons between the dietitian and the patient.
Exactly. They're
Oh.
constantly observing the patients. They're providing valuable information to the dietitian, and they're making sure that the prescribed interventions are actually happening.
So they're really keeping a close eye on things,
Absolutely.
making sure the patient is actually eating, tolerating the food, and that sort of thing.
Right. And they're also there to answer the patient's questions, provide encouragement,
Yeah.
advocate for their needs. It's really about creating a culture where nutrition is valued as part of the healing process.
I love that. Creating a culture that values nutrition. That's fantastic.
Yeah, it's really important.
Okay, so we've talked about the role of the dietitian, the role of the nurses, but let's face it,
Yeah.
hospital food has a bit of a bad reputation.
It does.
So how are hospitals actually going about feeding patients these days?
Well, like I said, the days of those pre-selected meal trays are starting to fade away,
Okay.
and a lot of hospitals are moving towards this more personalized room service model.
Room service in a hospital.
I know, right?
So I can order a cheeseburger at 3 a.m.
Well, not quite,
Okay.
but it does give patients more control over what and when they eat.
Data.
So they can choose from a menu, they can have their meals delivered to their room at a time that works for them.
What's that?
Some hospitals even have cook-to-order systems, so the food is actually prepared fresh based on the patient's choices.
Wow, that's amazing. So no more mystery meatloaf?
Hopefully not.
That's great. And you know what? I can actually see how that would make a big difference.
Oh, yeah, absolutely.
Just in terms of people's morale and their willingness to actually eat the food.
Totally. And studies show that it actually leads to people eating more, wasting less food, and feeling happier about their meals.
That makes a lot of sense.
Yeah, so it's a win-win all around.
So what about those situations where someone just can't eat enough on their own?
Right.
Even with the best room service in the world, what happens then?
That's where things get even more specialized. So there are different types of oral diets,
Right.
like, clear liquid diets after surgery,
Right.
or pureed food for people who have difficulty swallowing.
Okay.
And then there are also therapeutic diets that are tailored to specific conditions. So, for example, low-sodium diets for heart patients.
Oh.
Or carbohydrate-controlled diets for people with diabetes.
Got it. So it's about having a whole toolkit of options
It's-
to address different needs.
Right. And remember Miguel, our laminectomy patient.
Yeah.
Let's say he's ordered a regular diet after surgery, but his throat is sore and the food just doesn't appeal to him.
Okay.
What would you do to help him get the nutrition he needs?
Well, first, I would want to understand why he's not eating.
Good.
Is it the pain? Is it the taste of the food? Is it something else?
Right.
And then maybe we could see if there are alternative menu options that are more appealing or easier to swallow.
Excellent thinking. We might also consider a modified consistency diet until his throat feels better, or we could use those high-protein oral nutrition supplements that we talked about earlier,
Right.
just to make sure he's getting enough calories and protein while his appetite recovers.
So it's like a puzzle, using all these different pieces
Exactly.
to create a solution that works for Miguel.
And that's really the heart of nutrition care. It's all about individualizing the approach
Yeah.
to meet each patient's unique needs and preferences.
I love that. So it's not just about, throwing food at people.
No, not at all.
It's about really understanding what they need and how to best support them.
Absolutely.
But even with the best plan in place, it's still important to keep track of how things are going.
Oh, absolutely. It's like checking the gauges on your car.
Right.
You need to make sure everything's running smoothly.
So how do healthcare professionals monitor the effectiveness of the nutrition plan?
That's where the final piece of the puzzle comes in.
Okay.
Monitoring and evaluation. And we'll talk more about that after the break.
Sounds good. We'll be right back. Welcome back. We're talking about how healthcare professionals keep track of how the nutrition plan is working for a patient.
Right. Like we said, it's like checking the gauges on your car.
Exactly. Making sure everything's running smoothly.
You want to make sure the plan is actually working. Are they eating enough? Are they gaining or losing weight when they shouldn't be? Any signs of, complications?
So it's not just setting a plan and forgetting about it.
No, not at all. It's a process. It's ongoing.
Gotcha. So the dietitian is constantly checking in, getting feedback.
Right, and making adjustments as needed.
Okay, so they might tweak the calorie bearers or try different supplements.
Yeah, or even recommend a completely different type of diet.
So it's really personalized.
Exactly. It's all about finding what works best for that individual patient.
That makes sense. But this all makes me wonder about, preventing malnutrition in the first place.
Yeah.
It feels like we're always playing catch up once someone's already in the hospital.
I agree. I think prevention is key.
Yeah, so how do we do that? Are we talking about more nutrition education in schools?
Education is definitely a big part of it.
Okay.
But it also goes beyond that. We need to address things like food insecurity.
Right, making sure everyone has access to healthy, affordable food.
Exactly, because if someone can't afford fresh fruits and vegetables, it doesn't matter how much they know about nutrition.
That's a really good point. So it's about creating an environment where everyone has the opportunity to make healthy choices.
Absolutely.
So what about in the hospital setting? Are there any advancements happening there to improve nutrition care?
Oh, yeah. There's a lot of cool stuff happening.
Like what?
Well, technology is playing a huge role, for example.
Okay.
Imagine wearable sensors that track a patient's nutrient levels in real time.
Wait, seriously?
Yeah, kind of like a Fitbit for your nutrition.
Wow, that's amazing.
And then picture AI-powered systems that crunch that data and recommend custom meal plans.
So it's like having a personal nutritionist in your pocket.
Pretty much. And some of this is still in development, but it's not that far off.
That's really exciting. So what other innovations are we seeing?
Well, there's also a growing movement towards food as medicine.
Okay, I've heard that term before. What does it actually mean?
It's basically recognizing that food can be a powerful tool for healing and preventing disease.
So it's about using food to address the root cause of the problem.
Exactly. And this is where culinary medicine comes in.
Culinary medicine?
Yeah, a lot of hospitals are hiring chefs who are trained in both cooking and nutrition.
Oh, wow. That's awesome.
So they can create meals that are delicious and also promote healing.
So no more sad, soggy vegetables.
Hopefully not. It's about recognizing that food can be enjoyable and comforting, even in a hospital setting.
That makes a lot of sense. I think that would make a huge difference for patients.
Yeah, I think so too.
But with all this talk about technology and fancy meals, I have to ask, where does the human element fit in?
That's a great question. And I think it's really important to remember that technology can't replace human connection.
Right. At the end of the day, it's about people caring for other people.
Absolutely. And that human connection can be just as powerful as any medication or treatment when it comes to healing.
So it's about finding that balance, using technology to empower and inform, but never losing sight of the human touch.
I couldn't have said it better myself.
But even with the best of intentions, there are situations where things can get ethically tricky.
Definitely, there are always ethical considerations in healthcare.
Like what?
Well, for example, what happens when a patient can't make decisions about their own care?
Oh, right, like if they're unconscious or have dementia.
Exactly. Who gets to decide what's best for them?
That's a tough question.
It is, and it's something that healthcare professionals have to grapple with all the time.
So how do they navigate those situations?
Well, sometimes there are legal documents like advance directives that can help guide decision-making.
Right, where people can express their wishes for future care.
Exactly. But even then, it can be complicated.
Yeah, what if those documents don't exist or aren't clear?
Then it often falls to family members or loved ones to make those difficult choices.
Wow, that must be incredibly hard.
It can be, and that's why it's so important for healthcare providers to have open and honest conversations with families.
So it's about providing support and guidance during a really difficult time.
Exactly.
This adds a whole new layer of complexity to nutrition care.
It does. It's not just about the food itself. It's about the whole person.
And their families.
And their families, their values, their beliefs.
So it's really holistic.
It is, and I think that's what makes it so fascinating.
I agree. Well, we've covered a lot of ground today.
We have.
From the science behind nutrition to the ethical considerations and the exciting innovations that are shaping the future of this field.
It's been a great conversation.
I agree. And to our listeners, we hope this deep dive has given you a better understanding of the vital role that nutrition plays in healthcare.
Absolutely. It's about so much more than just calories and protein.
It's about healing, well-being, and the power of human connection.
Keep asking questions, stay curious, and keep learning.
There's always more to discover in the world of nutrition.
Thanks for listening.
Thanks for listening. Okay, so before the break, we were talking about all those tricky ethical issues.
Yeah, the tough decisions.
Yeah, so let's try to end on a hopeful note, huh?
Absolutely.
Let's look at what the future holds for nutrition care.
Right. There's so much to be excited about.
Yeah, let's talk about that.
Remember that food as medicine concept?
Yeah.
It's gaining so much momentum, and it's really changing healthcare.
Yeah, so instead of just treating symptoms, we're starting to focus on preventing disease through nutrition.
Exactly. And, even using food as a tool to help people heal.
Yeah, it's pretty amazing. I mean, it makes sense, right? We've always known that food is important.
Right. But now we're really starting to understand how powerful it can be.
Yeah. So what kind of cool innovations are happening in that space?
Well, one thing I'm really excited about is culinary medicine.
Culinary medicines.
Yeah, it's basically about combining the art of cooking with the science of nutrition.
Okay, so we're talking about chefs who are also nutrition experts.
Exactly. And they're working in hospitals, creating meals that are delicious and nutritious.
Okay, so no more mystery meat and soggy vegetables.
Hopefully not. The idea is to make hospital food appealing and enjoyable, something that people actually look forward to eating.
Yeah, I mean, that makes a huge difference. When you're not feeling well, the last thing you want is unappetizing food.
Absolutely. Food should be a source of comfort and pleasure, even in a hospital setting.
Totally. And you know what? I can totally see this becoming a trend, like gourmet hospital food.
Yeah, why not? If it helps people heal faster and feel better, I'm all for it.
Me too. Okay, so what about technology? I know we talked about those personalized nutrition plans earlier.
Yeah, those are definitely on the horizon.
So, like, imagine getting a meal plan that's tailored to your specific needs, based on your genetics, your gut microbiome, even your taste preferences.
Exactly. It's like having a personal nutritionist in your pocket.
That's wild. And I bet AI will play a big role in that.
Oh, absolutely. AI can analyze massive amounts of data and come up with personalized recommendations.
So this is all really exciting. But with all this talk about technology and cutting-edge science, where's the human element fit in?
That's such an important question, and honestly, I think the human element is more important than ever.
Really?
Yeah, technology is a tool, it can help us, but it can't replace human connection and compassion.
Right. At the end of the day, it's about people caring for other people.
Exactly, and that's something we should never lose sight of.
I totally agree. So it's about finding that balance, using technology to empower and inform, but always remembering the importance of empathy and human connection.
Couldn't have said it better myself.
Well, this has been an incredible journey we've talked about so much, from the science behind nutrition to the ethical challenges and the amazing innovations that are shaping the future.
It's been a pleasure diving into this topic with you.
Likewise, and to our listeners, we hope this deep dive has given you a new appreciation for the importance of nutrition in healthcare.
It's about so much more than just what we eat. It's about healing, well-being, and the power of human connection.
Keep asking questions, stay curious, and keep learning.
There's always more to discover in the world of nutrition.
Thanks for listening.
Thanks for listening.